Hello friends, this is Arpita, and in this video I am going to explain you scapula. The first feature of a scapula is that it is triangular in shape and which you can easily identify it from the diagram. The diagram which I show you has two views. The first one is the anterior view and the second one is the posterior view. So let's begin. Scapula lie in the posterior lateral axis of our body. Each scapula has two surfaces. The first one is the anterior surface, which is also known as costal or ventral. The first view is the anterior view, and the surface which you are seeing in color yellow is the costal or the ventral surface, which is called subscapular fossa and has a muscle attachment which is subscapularis muscle. The second surface is the posterior or the dorsal surface, which is divided into supraspinous fossa and infraspinous fossa due to the presence of this spine. Supraspinous fossa has a muscle attachment, supraspinate muscle. Infraspinous fossa has a muscle attachment, infraspinous muscle. Scapula has three borders and three angles. The first border is the superior border, which is present near subscapularis notch. Then medial border, which is present between superior angle, which is this one, and inferior angle. Medial border is the thinnest and the longest border, as well as it faces vertebral column. Lateral border present between inferior angle and glenoid cavity. Superior angle is present between superior border and the medial border. Inferior angle is present between medial border and the lateral border. Lateral angle is present between lateral border and superior border. Lateral angle is also known as glenoid angle, as it is the glenoid cavity. These borders and angle have some muscle attachment. So, the superior border, which is this one, has inferior belly of omohyoid muscle attached to it. Lateral border has two muscles attached to it. Dorsal view of lateral border has muscle attachment, which is in upper 2/3 part it is attached to the teres minor muscle, and in the lower 1/3 part it is attached to teres major muscle. It has different attachments on its posterior and the anterior side. So let's first see the posterior attachment. In posterior upper part, beginning from superior angle to the root of the spine, it has levator scapulae muscle attached to it. At the opposite end of root of spine, it has rhomboideus minor muscle attached to it, and from the below spine it has rhomboideus major to the inferior angle. Angle originate latimus dorsi muscle. The anterior of the medial border has a muscle attachment of serratus anterior, which begins from the superior angle to the root of spine, which you can see from here, which exactly lies here, and from this it gives 2 digitation more of the same muscle, and remaining 5 digitations begin afterwards and ends to the inferior angle. Now let's talk about glenoid cavity. You can see in anterior view this is the glenoid cavity, and in the posterior view this is the glenoid cavity. This glenoid cavity has tubercle. The tubercle which is present on the upper part is supraglenoid tubercle and has the attachment of the long head of the bicep brachii. The tubercle which is present on the lower part is infraglenoid tubercle and has the attachment for the long head of tricep brachii muscle. This glenoid cavity along with humerus forms shoulder joint. Scapula has 3 processes. One is the coracoid process. The second one is the acromion process, and the third one is the spinous process, this green part. The tip of the coracoid process give origin to the short head of the bicep brachii, coracobrachialis muscle, and the superior surface receive insertion for the pectoralis minor muscle. The lower lip of the spine and the lateral border of the acromion process give origin to the deltoid muscle. The lower crust of the spine and the lateral border of the acromion process give rise to deltoid muscle. The upper crust of the spine and medial border of the acromial process give rise to trapezius muscle. Talk about ligament attachment. The ligament which is present between coracoid process and acromion process is known as coracoacromial ligament. Ligament which pass below the coracoid process is the coracohumeral ligament. The superior surface of the coracoid give attachment to the clavicle, which is known as coracoclavicular ligament. This suprascapular notch get converted into foramen due to the attachment of ligament, which is known as suprascapular ligament, converting it into a foramen through which suprascapular nerves passes. The notch between spine and the glenoid cavity, which also get converted into foramen due to the presence of spinoglenoid ligament. This we complete scapula, but you need not to worry as you find like there is no marking in the diagram, as I have made all the notes which I have taught you in this video, and I will post them in the last. Thank you friends.